Good afternoon, everyone. Welcome to today's session. My name is Nugus, and I will be your moderator for today. We are excited to have you all here for this enriching experience. Today, we have a wonderful mentor who will share his insights and expertise on e-health, legal issues in healthcare, as well as healthcare contracts and transactions. Our agenda for today includes first presentation will be made by Ventis, followed by our mentor's presentation. Then after that, we'll have feedback sessions as well as a Q&A segment where all of you can interact directly with our mentor. Let's make this session interactive and engaging, and all of you are encouraged to put your videos on. And before moving on to the mentee's presentation, I'll make a short announcement. Yes, before welcoming our mentee's presentation, we have an announcement for all creatives, entertainers, athletes, innovators, and startups. We are excited to offer a free legal clinic where you can get a 20-minute consultation with legal professionals. We encourage you to take advantage of this opportunity to have your contracts reviewed and to get an expertise advice. You have to simply submit your documents through the registration link.
Hello, Nugus. Can you hear us?
Yes, can hear.
Okay, it seems Nugus is frozen. I don't know. It's like his network is having issues. So sorry about that. So while we wait for him to come back on, so he's making an announcement on the free legal clinic that we started talking about last week. And then we're giving the opportunities for those in the creatives, the entertainers, athletes, innovators, and startups who wants a form of legal advice, but maybe cannot afford it at the moment. You can just kindly register with us. You can reach out to me, and I will do well to direct you accordingly. So thank you for that. So moving on, right? Today we'll be having a combination of two topics. Like Nigus earlier announced, we'll be having e-health, legal issues in healthcare, and healthcare contracts and transactions is a merger of week 3 and week 4's topics. So we'll be having Mr. Ebenezer Egwatu helping us run through the course of the program. Thank you so much, sir, for joining. We're always happy to have you with us. I'm sure our mentees are ready and excited to hear from your wealth of experience, and also for you to help give us direction and understanding as regards to this topic. So not to waste any other time, right? We would like to go to the presentation of the mentees so that we can have ample time, so that Mr. Ebenezer can have ample time, right, to just give us a total breakdown of the topic and help us. So please, if you, the group presenter for the week, you can kindly start sharing your slides and then start your presentation. You have 10 minutes for the presentation.
Good evening, Mr. Dennis. Good evening, everyone.
Yes, good evening. We can hear you, Blessing. Welcome.
Please, I can't share my slide now. Can you help me in sharing the slide?
All right. So just give me a minute. I will do that shortly.
Okay. So good evening, everyone. My name is Blessing Ezibe. I'm the backup presenter for Group 1 because the main presenter is unavailable now. So I don't know if I should continue.
Just continue. It's coming up right now. It will soon be up.
So our topic today is e-health and legal issues in emerging healthcare tech and healthcare contracts and transactions. Then under e-health and emerging healthcare tech, we have introduction to e-health, emerging healthcare technology, legal and ethical issues in emerging healthcare tech, addressing those legal issues. Then under healthcare contract and transactions, we have introduction to healthcare contracts and transactions, types of healthcare contracts and transactions, key components, challenges and considerations, importance and of effective management, then questions and answers. Okay, then introduction. E-health, what is definition for e-health? E-health refers to the application of information and communication technologies in healthcare to improve patient care, enhance services, and streamline healthcare management. It encompasses everything from digital medical records to online consultation. This means that e-health includes technologies that are already widely used, accepted, and proven in the healthcare industries. Whereas emerging healthcare technology are new, innovative technologies, treatments, and methods that are transforming the healthcare industries. These advancements aim to improve patients' outcomes, enhance the quality of care, and increase efficiency in healthcare delivery. Examples of e-health are telemedicine. These are remote diagnosis and treatments of patients via video calls or apps. Then we have AI diagnostics. That is the artificial intelligence tools that assist doctors in interpreting scans, predicting health risk, and suggesting treatment options. We also have mobile health apps. It's also part of the e-health. Applications. There are applications that track patients' health metrics, such as fitness trackers or diabetes management apps. Then electronic health records, EHR, that are the digital versions of patients' paper charts, allowing healthcare providers to access patients' data in real time. Others are also health information system, HIS, remote patients monitoring, RPM, electronic prescribing, AI-powered chatbots, then e-learning for healthcare professionals. Importance of e-health to patients. Importance of e-health to patients and health providers are improve access to healthcare. It helps people access healthcare services remotely, especially those that are living far from hospitals or with mobility issues. And it also allows patients to consult doctors online, reducing traffic. Like when you go to hospital, people will food there. So it helps in one-on-one access to healthcare. Then enhance healthcare delivery. That's number 2. It makes it easier for healthcare providers to manage patients' care and communicate with each other. That's how it enhances healthcare delivery. So it costs effectiveness, the third one. It reduces costs by minimizing and tackling health workers shortage. Number 4 is tracking health worker shortage. Okay. Then that health worker shortage it addresses healthcare worker shortage by enabling remote consultations and automating administrative tasks. Patients education and engagement. It provides patient education, telling the patients their charge, and then it gives them it educates the patients on what their treatment, and it engages the patients on one-on-one, improving health outcomes. It leads to better health outcomes by enabling early detection, timely interventions, and personalized treatments, addressing non-communicable diseases. It helps manage chronic conditions like diabetes and heart diseases early before they get out of hand. So number 8 is collaboration across healthcare providers. It does this by by providing communication, that is exchange of information among healthcare providers all over anywhere around the world. Then data collection and research. E-health enables the collection of valuable health data, which informs research policy and quality improvement initiatives. Sorry.
Cannot hear you.
Okay, I'll be louder. Sorry for that. Number 10 is disease surveillance and public health management. It enhances disease tracking, outbreak detection, public health response through real-time data analysis and reports. Then we have the emerging healthcare technologies. So the globally emerging healthcare technologies are AI and machine learning. This enables remote consultations and monitoring with the use of video conferencing for virtual consultation of doctors, remote patient monitoring for patients that are quarantined. You can be monitoring them through the use of AI and machine. Sorry, you can. Okay, that is the use of telemedicine and telehealth. Sorry for that. The AI and machine language are used for medical data diagnosis to diagnose disease and develop personalized treatment plans. So number 3, we have wearable health devices like Apple Watch and Fitbit. They are used to track the heartbeats of people. And then we have the blockchain for healthcare. That's the electronic health records. The blockchain enables data sharing among the doctors and it ensures privacy. There's also 3D printing of dental implants, surgical tools, and even house valves. Then robotic surgery. Number 6, robotic surgery is used to do surgeries that robotic surgery enhances precision and minimizes invasiveness and reduces recovery time. It assists in surgeries for cancer treatment and for joint replacement. Number 7, then gene editing. Gene therapy for sickle cell and cancers. This is used for editing of genetic diseases like sickle cell diseases. That is diseases that are genetic, hereditary diseases. So emerging healthcare technologies in Nigeria are telemedicine platforms like Glow Care. They connect patients with doctors remotely. We also have the mobile health apps. That is the examples of Live Bank, and we also have the e-pharmacy services. Examples are drugstore and medplus, where you can get drugs online and it will be delivered to your house. We have the electronic health records. It stores patients' medical information digitally, making it easy for doctors to access and share patients' data. We have number 5, the mobile diagnostics and point of care devices for HIV, hepatitis, and hepatitis patients. Is used to test diseases like HIV and hepatitis. It is faster to use for test of HIV. It helps to identify diseases early and making treatments more effective. Health data analytics, e.g. eHealth Africa, is used to track diseases and improve healthcare services. So the legal framework guiding e-health in Nigeria, and NHA, National Health Act, which was enacted in 2014. It ensures quality of service across Nigeria, and it regulates healthcare services and standards. Nigeria Data Protection Regulation, this, which was enacted in 2019, this act protects patients' data, privacy, and security in using electronic records. We have the National Information Technology Development Agency, which was enacted in 2007. It governs ICT development, including e-health infrastructure and digital services. Then we have the Cyber Crimes Prohibition and Prevention Act 2015. This act safeguards against data breaches and cyber threats, ensuring e-health platform security. There's also the National Health Insurance Scheme 2004. It regulates health insurance, including e-health services, to ensure accessibility and affordability. Then there's also guidelines for health records management in Nigeria 2019. And medical and dental practitioners, which regulates medical practice, including telemedicine, to ensure quality of service in Nigeria. Medical and Dental Practitioners Act. So legal and ethical issues in e-health. One is lack of comprehensive legislation. This issue is because there is no single law there's no single law that can be said now that, okay, this is the law that will govern e-health in Nigeria. The legislations are scattered, as Mr. Egwatu said in the last class, that there's no single legislation that is governing e-health in Nigeria, that is governing health in Nigeria. So this is an issue. This is an issue which leads to confusion for people to even know the one that will apply for e-health. So that's the number one issue. Then number two is compliance with international standards. So e-health providers must comply with global standards, but this is challenging to keep up with. Then regulatory gap and uncertainty for telemedicine in Nigeria. Excuse me. Medicine is not clearly regulated in Nigeria, making it difficult for providers to know what is allowed. Making data protection complexity. Okay, so sorry. Licensing and registration challenges. Okay, before an e-health platform is established, getting license is actually an issue. So it's always hard for them to get a license because there's many authorities that they have to go to get a license that they will use to operate. So it's always hard for most of them to get a license and they will use and operate. Then we have data protection complexity. E-health platforms may struggle to protect patients' data because Nigeria data protection laws are complex. Then cross-border footprint. E-health services often cross borders, raising questions about which laws apply and how to comply. Like patients in Nigeria may use telemedicine platform based in the US. So it creates jurisdictional issues. Insurance and reimbursement coverage. E-health services may not be covered by insurance, creating uncertainty for patients and the health provider. Jurisdictional issues deals with the laws that will apply when using e-health services. Like someone in US using, okay, let's say someone in Nigeria using e-health services in the US. So which law will apply when there is an issue and they want to settle the dispute? Which jurisdictional law would they use to settle the issue? We also have the medical liability malpractice. E-health providers may be held liable for medical errors or practice, but the legal framework is unclear. So addressing those legal issues, addressing the legal challenges facing e-health in Nigeria involves several key areas. The number one is regulatory framework. Establishing clear This regulatory framework deals with establishing clear laws, guidelines, and standards for e-health in Nigeria. This can be done by defining e-health services and setting standards for quality and safety. So we have data privacy and security. This is protecting sensitive patients' information, ensuring confidentiality, and implementing robust data encryption. Number 3 is interoperability. This can mean to enable seamless sharing and use of health data between different healthcare providers and ensuring data standardization. Legal recognition is that e-health services should be recognized as a service and as a legitimate service. This is that he's saying that electronic prescriptions and records should be allowed, and it should also be enforced in Nigerian laws. Like e-health contract should be enforced. It's not when it gets to court, they might say, oh, this is not enforceable, or a lawyer might even, if there's an issue with a patient, they might even say that, okay, this cannot even hold. This case is not enforceable. So this one is saying that it should be recognized as an issue that is addressable in a court of law. Number 5 is informed consent. This is ensuring patients understand and agree to e-health services before they start administering treatments to them. Then we have liability and malpractice. This is defining accountability for e-health providers, establishing clear liability standards, and addressing medical errors and providing remedy for patients. Number 8 is professional licensing. Licensing healthcare professionals for e-health and enforce continuing education for the health providers. That is training, making sure that they undergo training even after certifying them. That's the professional licensing. That is what it's talking about. So addressing these legal challenges involves collaboration between government bodies, legal experts, healthcare providers, and technology developers to create a robust legal and regulatory environment for e-health in Nigeria. Healthcare contracts and transactions. This is the next topic we are treating: healthcare contract and transaction. First of all, what is a contract? That's what we should know. A contract is a legally binding agreement between two or more parties, and it is enforceable by law. That's what a contract is. Then a transaction refers to an exchange of value for funds between two or more parties. So healthcare contract, these contracts can include provider agreements, insurance policies, and employment contracts within healthcare institutions. They define the terms of service delivery, payment structures, and compliance with regulations. Then healthcare transactions, this encompass billing and reimbursement process, claims This encompass billing and reimbursement processes, claims management, and financial interactions between healthcare providers and insurers or patients. Transactions are critical for ensuring that services are paid for and that financial operations are transparent and efficient. So, importance of healthcare contracts and transactions in in the Nigerian healthcare industry is number one is regulatory compliance. The importance is ensures regulatory compliance. This ensures healthcare providers fully follow government rules and guidelines. Then financial management and stability. It helps healthcare providers manage their finance and manage their finance. Good financial management ensures there's enough income for the hospital to be able to provide better care for their patients. Access to quality care, that's number three. It ensures patients receive high quality treatment and care. It will make the hospitals provide expert doctors for patients, knowing that there is already a contract that if they okay that if they not fulfill to the obligation of their contract, then there will be there's legal implications for it. So they will have to make sure that they provide quality expert doctors for their patients. Then we have legal protection and accountability. Patients patients' rights, it protects patients' rights and holds providers accountable. Then quality protection. Patients' education and informed consent. It ensures patients understand their treatment options. Doctors will explain risk and benefits clearly to patients before they start the treatment. That's what the patient education and informed consent is talking about. Number seven is data management and confidentiality. It it protects patients' information, patients' sensitive informations, and keeps patients' information safe and private. Types of healthcare contracts. We have informed
Blessing,
consent.
can you hear me? Can you hear me, Blessing?
Yes, I can.
Yeah. You have 5 minutes. Can you conclude your presentation with that time? 5 minutes.
Okay. Sure, I will try and
Okay,
run
thank you.
through. Okay, types of healthcare contract. We have informed consent, patient-provider agreement, managed care contract, health insurance contract. Then other types of healthcare contracts are physician recruitment contract, physician employment contract, medical director contract, patient transfer contract, equipment lease contract, research and clinical trial agreements, pharmaceutical and vaccine supply contracts. There are also challenges facing healthcare contract. These are inadequate legal framework. This has to do with the fact that there is no exact clear laws that regulate healthcare contract. Then we have complexity. It has to do with complex that healthcare contract contain complex terminologies like that makes it hard for people to even understand the contract they are going into. Data privacy security. This has to do with the fact that there's no most of the contract, there's no confidentiality, like keeping the patient's information safe. Corruption and fraud, it has to do with overbilling, kickbacks, and all that Mr. Ebenezer taught us in the previous classes. Economic constraints has to do with finance. Limited insurance coverage has to do with the fact that most of the treatments are not covered by insurance companies. Traditional practices and beliefs. This one has to do with a lot because most times the patient's beliefs have to, like, it makes doctors not to be able to treat the patients right. Like there's a particular case of Medical and Dental Practitioners Act, Medical and Dental Practitioners Professional Tribunal, and Okonkwo, where it was versus Okonkwo, where it was held that a patient that a patient have the right to their religion. But in the case of a child, it was held that a patient's religion and belief will be put aside to make sure that the patient is safe. That's what the law held in this particular case of traditional practices and beliefs. Then importance of effective management of healthcare contracts. Effective contract management is important in healthcare for a number of reasons, including compliance. Effective contract management helps ensure that healthcare organizations comply with regulations, which is important for keeping patients and workers safe. Risk mitigation, efficiency, transparency, vendor relationships, contract life cycle is a system for managing contracts. Should make it easy to track renewal dates, key fulfillment obligations, and other vital aspects of contracts. Healthcare organizations must manage contracts with suppliers, service providers, insurance companies, and other parties. Q&A. There are questions raised, which are most of the impacts we see regarding e-health in Nigeria were done by private bodies. What exactly has the government done to improve e-health and telemedicine in Nigeria? Number 2 question is, what is the current state of e-health infrastructure in Nigeria, and what investments are being made to improve it? Now, the last one is an e-health. How can health care contracts in Nigeria be structured to prioritize patient-centered care and outcomes? Thank you for listening. That's all for now.
Thank you, Blessing, for the thoughtful, well-prepared, and very much detailed presentation. Now we will proceed with the presentation from Mr. Ebenezer. And I'd like to introduce Mr. Ebenezer here, and you can also give your feedbacks for the presentations that were made just now.
Okay, thank you very much, Mr. Moderator. Can you hear me?
Yes, we
Awesome
can.
presentation from the group. This is probably the most in-depth research that has come from these sets since we started. This is probably the most in-depth research. The research is thorough. Just a few corrections that I need to make. So can we run through all the slides? Just go to the slide from the beginning. Just on the slides, they have who presented? Who presented?
Is me, sir. Blessing.
Okay, Blessing. How many of you people participated in this research? How many? How many of you?
Names of the people that participated actually at the up right of the.
Okay.
Up.
Okay. Let me check my copy. Okay. Only 4 of you. 1, 2, 3, 4. Okay. Omokere, Esther, Blessing, and Abba. Williams, is that what you assigned to them? Are there the number of people you assigned for this presentation?
No, I assigned a little more, a few others, but it seems those were the only ones that contributed.
We cannot hear you, Mr. Dennis.
Oh, all right. So, sir, I said, can you hear me now?
Yes, go ahead.
Yes, I said I assigned more, but these were the ones that eventually worked on the presentation.
Okay, Ugochukwu is saying you should grant him access, so admit Ugochukwu. One of our participants, he just sent a message that he should be granted access. So check, the host, check and admit him. Okay, so
all right,
let's go through, yes, let's go through the slides all over again. I just want to correct some wrong information that are contained on the slide. Of course, there are mistakes, so not that they set out to misinform the class. No, So basically, all she has said up to slide, I am on slide 5 now. Lego frameworks in guiding health ethics. Okay, firstly, guiding e-health. Firstly, let's look at what e-health is. Are they practical in Nigeria, being our, of course, jurisdiction where we are based? So, e-health, yeah, they compass, she mentioned it, basically, digital access to healthcare services. E-health is a fusion of science and technology in delivering healthcare. So, example of e-health, a classic example is telemedicine. Telemedicine is a system of practice of medicine whereby the doctor sits in his house, in his office, far away from the patient, and they communicate and they have a session. The doctor, patient, maybe diagnostic session, maybe a checkup session, maybe a treatment session, but it is done online. It is not physical. Now, it has a lot of advantages, and it also has many disadvantages. One of the advantages of e-health or telemedicine is speed of access, quick access to healthcare professionals. Now, there are 3 main delays that cause deaths in healthcare service delivery. 3 major delays are responsible for deaths. Number 1 is delay at home. A person has a medical condition, he just feels he can manage it. He just feels he can just deal with it. He might be praying, believing God for healing. He might be procrastinating. He might be trying traditional herbs. He might also not be doing anything. He might not even know that he has a health condition. He might not know that he has a challenge. Sicknesses like hepatitis, until you are screened, you may not know. Sicknesses like cancer, until you are screened, you may not know. So now, because of that delay, the person gets to the hospital when it is already too late, and that leads to death. The second delay is delay on the road. You know, some remote areas where there is no access to good healthcare facility. There are places, there is good healthcare facility, but there is no access road. The road is bad. There are a lot of things wrong with our road and easy access to healthcare. So number 2 delay is delay at home, on the road. Number 3 is delay in the hospital. When you can get to the hospital, due to institutional protocol, that we say go there and buy card, go there and make payments, go there and confirm payments. Within 1 hour, or in some big hospitals like tertiary facilities, 1 hour, 30 minutes to 2 hours that somebody was brought into the hospital, no healthcare professional has attended to the person because they are following institutional protocols to document the patients. Now, these 3 delays I mentioned can be waived with e-health. For example, telemedicine. A phone call, a video call with your doctor. Doctor, this is what is wrong with me. This is what is wrong with me. This is what is wrong with me. The doctor assesses you and prescribes medication. Now, that is one of the major challenges of e-health. I have talked about the benefits. Easy access to healthcare professionals. Now, how does telemedicine operate? Doctors, somebody floats a company, doctors subscribe, nurses subscribe, everything is online. They have consultants in different fields of medicine. They have a gynecologist, they have a cardiologist, they have a nephrologist, they have a brain surgeon and all that. So they have nurses. So if you present an issue, maybe it's a heart issue, they will connect you with a cardiologist. You might be in Nigeria and your doctor is in India. So once you present a problem, they connect you with the doctor, and the doctor begins to ask you questions and begins to. Now, one of the cardinal principles of treatment is that you must examine the patient before you begin to prescribe treatment. I mean physical examination. Now, there are some examinations or investigations now that will require conducting tests. But there are also some symptoms that, due to distance, the doctor will not be able to see. There are some symptoms the doctor can only get by physical examination, touching the patient. Do you understand it? Seeing the color of the patient's palm, seeing the color of the patient's eyes on a close range. Now, if we are having a video call and I say open your eye, or you open your eye, I say use your hand to widen your eye, I want to see the color of your eye. The quality of your camera can affect the color. So it is not the same with a physical examination, even though it is close. Now, there are some symptoms that the doctor may get by touching. So that aspect will be missing in e-health, meaning that a lot of results will be lost. A lot of diagnostic results will be lost, meaning that a lot of efficiency in diagnosis. So there is a loss of a percentage of accuracy in diagnosis, particularly where physical examination is required. Another challenge that e-health poses is data breach. Now, she mentioned Nigerian Data Protection Regulation. No, that's why I came to this. That's why I came to slide 5. What we have now is Nigerian Data Protection Act 2023. So Data Protection Regulation 2019 is no longer in existence. What we have is Data Protection Act 2023, and that is the law that regulates, that governs data. Anything that has to do with data in Nigeria is governed by that law, Data Protection Act 2023. So each time you are making your presentation or research, endeavor to get the accurate law in force. So loss of data, issues around cybersecurity, data protection. One of the rights of a patient is a right to privacy. And that privacy includes the privacy of his medical information or medical record, right to confidentiality of his medical record, of the nature of his ailment. Now, if you are doing telemedicine, what it means is that there will be exchange of data via the internet. Now, the implication of that is that it is possible that your data could be intercepted. I'm trying to open the medical and dental practitioners, code medical ethics for medical and dental practitioners, so that I will read to you what the provision says on telemedicine, particularly data protection. Hope I get this material. Okay, just give me a moment where my laptop crashed, so where I'm checking if I saved it, if it's in one of the flash that I have, so I will just pull it out from there. But if not, I will find a way around it. You need to know. Okay. No, it's not here. Okay, I will post it on the platform. I think it's session 22 of the medical and dental code of medical ethics. In reference to it provides for telemedicine, and it cautions healthcare professionals on the need to be very careful with handling people's data, because data can be intercepted on the internet. So the risk of a patient's data being intercepted by cyber criminals is there. So as a healthcare professional, if you are engaging in e-medicine or in health or telemedicine generally, you will have to be cautious around data, around privacy, around confidentiality. Those are key. Then issue of cybercrime, the Cybercrime Act covers that already. The issue of National Health Insurance Scheme, the law there is wrong. What we have here now is National Health Insurance Authority Act 2022. So correct it. National Health Insurance Authority Act 2022. That is the extant law on that. Now, on the issue of medical records and protection, it's already provided for in the National Health Act. So anybody who is handling a patient's medical record, whether physically or electronically, when you say that there are no laws, there are no there is no law in place specifically for e-health. However, the National Health Act covers broadly issues that relate to patient information and how to handle it. So anybody who is dealing with patient's record has a duty to protect that record, one. Two, to produce it or even give it to the right people when it is needed or required. But anybody who mismanages or mishandles or who has the responsibility to keep a patient's record and does not do it, the person will be liable in law, because the law grants you the duty to keep patients' records safe. So our information or things that pertain to patients' record is already covered under the National Health Act. I think it's section 23. Let me confirm. Yeah, that 23 or 23 is information, then 26 confidentiality, 27 access to health records. So section 27, note it, and section 28 of the National Health Act makes keeping patients' record. So whether you are, if you are, you are, that the fact that you are practicing telemedicine is not a sufficient defense for you to treat patients' information carelessly. Then let's go to the next slide that talks on, excuse me. Okay. Not this. Not this. Get me the slide on legal framework. Okay, that's slide 5. No. No. Good. Okay, that's slide 5 that we just treated now. Then the importance of healthcare contracts. The very most important factor in healthcare contract. Let us start with what is healthcare contract. Healthcare contract is basically a contract between stakeholders in the healthcare industry, different stakeholders that is reduced into writing. Now, who are these different stakeholders? It could be a government and a foreign partner that wants to invest in Nigeria in the healthcare sector. That is one. It could also be a contract between or within healthcare industries, the hospital and equipment suppliers. That is true. Three, it could be a contract within the healthcare sector, contract of engagement between doctors and hospitals. That means between healthcare service providers. It could be contract between consultants and the hospitals. So, like she rightly mentioned, a contract is agreement between parties that is enforceable in law. But you need to understand, firstly, that there are what we call elements of a contract. And it is when she said there are no laws regulating healthcare contracts, that is not totally so. Contracts is regulated. Now, once you have the elements of a contract in place, that contract is enforceable in law. What are the elements of a contract? For those of you who are law students, you already know that you must have your offer, you must have your acceptance. So if these key elements are not there, there is no contract. An offer is that one person is making an offer to the other person. I want to render this service, or I want to hire you to render this service to me. Acceptance is that the party to whom an offer has been made has accepted the offer. Then three, you now have consideration. Consideration is what value are we exchanging? Now, consideration is not necessarily money. Consideration could be exchange of services, more like a barter. Earlier this month, we had All African Medical Awareness exhibition. I was one of their guest speakers. They invited me to speak. We had hospitals from Egypt, hospitals from Egypt, Tunisia, Morocco. All of them came here in Nigeria, in Abuja here. And they came to tell us what they can offer. They wanted Nigerians to come to their place to receive treatments. Then the Egypt Air Hospital made an offer. He said, we are offering that any hospital in Nigeria that is bringing us a patient, let the hospital also send us their doctor along with the patient, so that as we are treating the patient, we train their doctor in that area of medicine. For example, if it is kidney transplant, if you are sending your doctor to the hospital, if you are sending your patient to the Egyptian hospital, you send him along with your doctor from your own hospital, so that the Egyptian hospital will train your doctor in kidney transplant. When he comes back, he becomes better equipped to do that work in Nigeria. Now, that is a kind of consideration. Primarily, people think when you mention consideration, you say, okay, money. Yes, how much are you going to pay me? How much am I paying you? But consideration is anything of value that one party gives to the other in exchange for whatever they have agreed. So, but in healthcare contracts, we can have a company say, let us supply hospital equipment in exchange for money. That is healthcare contracts. That is consideration. Another can say, let us supply your, maybe foreigners can say, Nigeria, we want to help you. We are coming to supply your hospital with equipment, but you are going to give us exchange students. You are going to give us your students to come to our hospital and learn. Sometime in July, I had a client who had a spinal cord injury. and he was mismanaged by a hospital in Nigeria. When he was seeking remedy, he went to a Turkish hospital here in Abuja and presented himself to the Turkish doctor. And the Turkish doctor told him something and said, this thing you are talking about, we don't have this type of complication in our place. My people in Turkey cannot treat you because this type of case, we only read it in textbooks. We have not seen it physically. You are the first person I'm seeing that has this type of case. Now they now referred him to India. They say, go to India. India has large population, one. So there are chances that this type of your case exists in India. Two, India has a lot of people who come to India for medical tourism. So it is possible that people from other parts of the world have presented this your case to India. Because they do not know that his case. If he goes to their place, it will be a value, even though they are treating him, but they are gaining value because he's bringing to them what they know nothing about. I asked the Egyptian guy for the exhibition I went for. I asked him, why do you want Nigerian doctors to Egypt? He told me that in Egypt, they don't have malaria. They do not understand malaria treatment. So why they want Nigerian doctors is when they bring Nigerian doctors, as you are treating them, as they are training you to know how to do kidney transplants, you are teaching them how to treat malaria, common malaria. For us, malaria is not in here. Within 10-15 minutes, if you enter any hospital, they know what to do to start treatment. But the doctor is telling me, in Egypt, we don't have malaria as a sickness. We don't understand the treatment. So what we want is for Nigerian doctors to come to Egypt and we teach them kidney transplants. They teach us how to treat malaria. Now, that can be a healthcare contract. And the consideration becomes that exchange of value. I want you to remove consideration from money. Remove your mind from money. Anything of value that both parties exchange is consideration. Then the third one is capacity to contract. The fourth one rather is capacity to contract. Both parties entering a healthcare contract must have the legal capacity to contract. What is the legal capacity? They must be above 18 years, each of them, or at least 18 years. Two, they must be of sound mind and of mental stability. So then finally, intention to create legal relation. We say that contract is an agreement that's enforceable by law, in law. Now, if they do not intend that the documents they are signing bind them, it is not a contract. When you say healthcare contract, you are merely qualifying the type of contract. The underlying word here is contract. So when you say healthcare contract, you can as well say building contract. You can say engineering contract. You can say equipment supply contracts. So I need us to dwell on the elements of contracts. Then you now talk about what is the importance of healthcare contract. The most important thing in healthcare contract is certainty. Certainty of what? Certainty of the terms of the contract. If the contract is not certain, then no party knows his obligation. No party knows what his right is. No party knows what is due him. So what are the examples of healthcare contracts? You can have public-private partnership, what we call PPP. Some private organization can write to government, we want to build a hospital here. Then we want to build the hospital and recoup and run the hospital for 30 years to recoup our investment. Then we hand over the hospital to the government. That is PPP. That's public-private partnership. Now, inside that contract, the government has the responsibility to provide land. The government has the responsibility to provide security. Then the investor has the responsibility to build to specification. So government has the responsibility to provide a building plan, how they want to build. Now, these are intricate details of the contracts. Then who is responsible for employment? Who is responsible? How do we do the money remittances? Okay, while you are running it for 30 years, is it that within that 30 years, nothing comes to the government, or within the 30 years, you take 90% and remit 10% to the government? These are intricate part of the contract. Then you also have government contracts. It could be to supply equipment to the hospital, government hospital. Then this same element, 5 elements of contracts I've mentioned must come in. Then you have insurance contracts. Now, the challenge with insurance contracts is that people do not seek legal advice to enter insurance contracts. That's a major challenge. They just see the document, the marketers come and present to you, market to you, tell you how much you pay as premium, and how much you will get. Then your eye is on what you will get. Then you do not read the tiny, tiny characters that are written, maybe some in font 5. It is deliberate. If you have seen even some bank documents, you will see that there are places that they write in font 14, font 12, font 11. Then they now come to disclaimer. And you are squinting your eye to read it. It is deliberate. They do that. That is where they put the devils. Because we say the devils is in the details. That's where they put the devils. So you won't be able to, you just look at it, your eye is on the money, then you squint your eye, you will not be able to read. You just read 2 lines, you forget it, you sign. Then when there are issues, then we go and concentrate on that tiny font that you refuse to read. Because that is where the things that will defend them, the things that will exculpate them from liability, that is where they are all written. Then you talk about another example of contracts, compliance standards. If you're talking compliance standards, what we have done regulatory compliance in this class, right? Now, it is an unwritten, not that it is unwritten contracts. How do I put it now? Compliance standards is not even an enforceable contract. I'm trying to get the right word. It is an implied, better. It is an implied contract in the sense that the government has said these are compliance regulations, regulatory compliance you have to follow. Now, they do not have the 5 elements of offer, acceptance, but there is this gentleman understanding that this is the rule I am supposed to follow if I am to practice as a healthcare professional. These are they are good, they are better as rules. These are the rules I'm supposed to follow. Now, if you come to engagement or employment contracts, if you are employing a doctor, you prescribe for him, first of all, how much you are paying him. What are his work hours? Even though he will not have you, a doctor does not do 8 to 5 or 8 to 6 or no. So you structure his timetable. On Mondays, you are on morning duty from this time to this time. Afternoon, you are this time to this time. Night, you are this time to this time. Then, in the event of emergency, you see the clause I just opened my mouth to say now. In the event of emergency, you could be called out of your house anytime to attend to emergency patients. Now, we may call that an omnibus clause. If you fail to include that omnibus clause, and the doctor signs a contract that has specified the days and time he should be in your hospital. If you call him anytime outside those days and he refuses to come, you will not hold him liable. Now, remember I told you that one of the most important, one of the major importance of contracts is certainty. Everybody knows what his obligation is. Everybody knows what expectation the contract requires of him. Then, what else did I point out? Good. The place you said types of healthcare contracts. Informed consent is not a type of contract. Informed consent is not a type of contract at all. Informed consent is a right a patient has. So it is not a type. Hello, presenter, can you hear me?
Yes, I can hear you.
Hello, beautiful.
Yes, sir.
Where you mentioned types of healthcare contracts. Informed consent is not a contract. Informed consent is a right a patient has to be explained to what he. Okay, let me put it this way. Informed consent is one of the rights of a patient to information. Not just that. But more importantly, informed consent is the right of a patient to agree to be treated. Now, before the patient agrees to be treated, that's why we call it informed consent. We could have said consent. Consent simply means the approval of the patient to the doctor to treat him or her. But when we say informed consent, it means that the patient has been informed under the patient's right to information. At least 5 cardinal things. 1, the nature of the ailment he's suffering from. 2, the cost implicated, the treatment options available, not the treatment option that the hospital has expertise in, not the treatment option the hospital knows how best to do. No, the treatment options available to treat that ailment, whether the hospital has the ability to carry out that one or not, but the treatment options available. 3, the cost implication of all treatment options. Each of the treatment options, if you follow this option, this is the cost. If you follow this, this is the cost. If you follow this, this is the cost. So 4, the likely side effects of those treatment options. Now, if we follow this option, the side effect is that there are 50-50 chance that you will go deaf. There are 50-50 chance that you will go blind on one eye. There is a 50-50 chance that you won't be able to give birth again. You will become impotent if you go through these treatments. So the person will now think and say, okay, do I still want to have children? Okay, I have 3 children. I don't want any more children. Give me this treatment. Or, I am yet to marry you. So I don't think I want this treatment for now. So we have mentioned 4. Then 5, which doctors don't usually tell the patients? The right of the patient to decline treatment. These are 5 elements, at least, constitute a patient's right to information. It is after you have told the patient these 5 things, and the patient weighs it and makes his own decision based on the information you have made available, and now says, doctor, I go with option A. That is when we say the patient has given informed consent. So if as a doctor, you didn't explain to the patient these things I just said in the way and manner the patient understands them to make a decision whether or not to go ahead with the treatment, you have denied the patient his or her right to informed consent. Is that clear? Hello?
Yes,
Hello?
sir. Very clear, sir.
Okay, I needed to get that. So we say that informed consent is an issue in telemedicine because you will just say over the phone and talk. and the patient is dying, and the patient says, yes, go ahead with the treatment, but you have not done the proper examination you need to do. Now, another issue is that patient's right to privacy could be breached because a doctor is in his office, you don't know how many people that are in that office while the doctor is talking to you. So another person is hearing who is not supposed to hear. Then another issue with e-health is issues of intellectual property. Issues that border on intellectual property, some patents, because the technologies you are using are creation of people. Now, we also have situations where some of these things some new technologies are even still undergoing trial. Now, if they are not properly patented, the technological innovations, it can bring intellectual property wahala. Then, compliance and enforcement. Another major problem with e-health and telemedicine is that the chances of people, quacks, practicing medicine is high. Now, every year for lawyers, we pay our annual practicing fee. That is what makes you to practice law for this year. In fact, that annual practicing fee, you pay it from 1st of January to 31st March of every year. And what you pay depends on how old you are at the bar. From 1 to 10 years, they have the amount they pay. From 10 to 15, from 10 to 14, they have the amount to pay. From 15 to 19, they have the amount to pay. From 20 and above, they have the amount to pay. Senior advocates have the amount they pay. Judges have the amount they pay. Now, if you do not make these payments between 1st January and 31st March of every year, you are not a lawyer for that year. Meaning that you do not have a right of audience in court. Meaning that if on the 1st of April you come to court and another lawyer says, my lord, this man has not paid his practicing fee, the judge will not hear you for that day. Once 31st March passes, even if you pay times 10 of that fee, it does not go to any issue. It doesn't make any meaning to the court again. Now, the same thing is applicable in medicine. The doctors pay their practicing license fee. They renew their license. They upgrade their license. Now, one of the rights of a patient is to know the area, the qualification of the doctor attending to him. Meaning that, or his area of specialty. By qualification, I don't mean whether you have distinction or pass in your medical school. No. Your qualification, I mean your discipline, to say, I am a cardiologist, I am a gynecologist, I am a nephrologist, I am a dental surgeon. To know who exactly is this man in terms of qualification. But when we are doing telemedicine, now what's their name? The NMA, Nigerian Medical Association, they have a committee that investigates quack. Meaning they go from hospital to hospital, or when they hear information, they find, okay, this person is parading himself as a doctor, but he's not. They investigate that quackery. In fact, by their own regulatory definition, quackery even includes if you have not paid your practicing license for the year. So it is possible that when we are doing telemedicine, the man is not in a hospital environment. He is in his house. He is all alone. So he can practice medicine without license. That is the point I'm making. 2, you see cases where it happens mostly in private hospitals, where they are understaffed. They don't have consultants needed in every area the way you have in tertiary institutions. The private hospitals, sometimes, not the big ones, sometimes are understaffed. They don't have all the hands. So you will now have a situation where a general practitioner is posing as a consultant. So it becomes an issue in telemedicine that somebody who doesn't have the requisite expertise in that area is posing to be an expert in this area. Now, one of the important points they raised is regulatory compliance. So how do we check now that anybody who is presenting himself, parading himself as e-health practitioner, so to speak, has the regulatory complies or qualifies to so parade himself? One, there is need to have a body established for e-health e-health practice regulation. So there is need to have one, a registered list of all telemedicine companies or telemedicine practitioners in Nigeria. Meaning that if you want to operate a telemedicine company, one, you go and register with them. In registering with them, you will now need to submit the names and qualifications of all your consultants, where they trained, their experiences. That is number one. Until we do that and have a database of that, we may not be able to tackle the issue of quackery as it relates to e-health. Then another challenge we have is digital literacy. Yes, the digital world is vast. It is beyond use of phone to send text message. It is beyond TikTok and Snapchat and what's the other one? Instagram and Facebook. No. So what you can do with your phone, digital literacy, is a serious challenge, in the sense that the healthcare professional can be digitally literate, but the woman who is in a remote village that, first of all, does not have internet facility, two, the only phone she has is Nokia 33, a Nokia Touchlight phone that does not even have internet, that is not internet enabled. So it becomes a challenge, because for e-health to work, both parties have to be on the internet at the same time and understand what they are doing. Then another challenge is maybe cultural barriers. You know, in Africa, we have a lot of superstition. I don't know why, but I think it's basically mental laziness to investigate. Mental laziness to investigate. I don't want to bring religion in. Religion even thrives to, in the extreme cases, on conjectures. Why do I say on conjectures? Now, for me, I am a Christian. The Bible is there, and the Bible tells me all that I need to know about God. It's contained in the Bible. Now, the extraneous or extra-biblical experiences I may have as a Christian, maybe if an angel visits me now, that is my personal experience. That is not the standard of the Bible. So I cannot now come and say that until an angel visits you, you are not a Christian. I cannot use my personal experience as the standard, which is exactly what is happening with us in Africa, particularly the western part and my country, Nigeria. So why did I say intellectual laziness? The African man is quick to attribute to the gods or to superstition what he does not understand. And the disadvantage we have in our parenting system is that we train our children not to ask questions. We have this ageism thing You are a child. What do you know? If a child, because you know, children are curious. They always ask you questions that you do not expect. Then when they ask such questions, if you don't know the answer, tell them tomorrow I will answer you. You go and ask, you go and browse, get your answers and come back. But what you will have here is shut up. A small boy like you. How can you be asking such questions? What do you want to do with the answer? When I was your age, I wasn't asking such questions. For this boy, you are beginning to talk to bad people. So such thing limits us. Now, how does it affect what we are talking about today? Cultural barriers. Our people, we have superstition about anything that is invention, anything that is technological advancement. When G5 network came, some people say CCCs, some people say they are using it to do whatever. Some people just make conjectures that are not substantiated, that they cannot substantiate. So, cultural barriers, religious barriers, which are basically superstition. You see an African, maybe I watched the video where two bodies of water flow closely together, they join, but they cannot mix. For an African man, he can establish an altar there to worship his ancestors. He can tell you history, what the water could know. But the white man will take sample of this water, subject them to test, and know scientifically why the two cannot mix together, even if you put them in the same container and shake them. So until we not necessarily get rid of our cultural practices, but cultural barriers, we do not trust technology. We are really suspicious of any great advancement in technology. So until we get rid of our cultural, I wouldn't call it, okay, cultural inhibition towards embracing technology. I think that's a better way to put it. Until we do that, we may not make serious progress in that area. So which other thing have I not touched? Apart from these ones that I pointed out, every other thing they said on the presentation is correct. Now, can we look at the questions? Question number 1. Most of the impacts we see regarding e-health in Nigeria were done by private bodies. What exactly has the government done to improve e-health and telemedicine in Nigeria? Okay, the underlying word here is improve. Firstly, we think that what government needs to do is to build. Not necessarily so. One of the major responsibility of government is to provide enabling environments. Once the government must not even build hospitals. I didn't say should not build. I said must not build hospitals. But the government can provide enabling environments where hospitals are run and managed properly. Why did I say the government must not build? The government is not good in management. Corruption ruins everything that is owned by the government. Because my people say that the goat that belongs to the community sleeps outside. Why does he sleep outside? Mr. A will think that Mr. B will bring the goat in. Mr. B will think that Mr. C will bring the goat in. Mr. C will think that Mr. D will bring the goat in. If everybody thinks that the other person will bring the goat in, nobody ends up bringing the goat in. The goat sleeps outside. That is what is happening in government establishments. But it does not happen in private sectors. Look at every private sector you know. They may not be at their peak, but you see management, you see their money, they follow it. It is only in government establishments that you can award a contract, and the contract is not executed and you have given money and you do nothing about it, because somehow, the money you gave out found their way back to your personal pockets. So what the government is doing or should be doing to promote e-health is to create enabling environments. How? Firstly, the government, through the Medical and Dental Practitioners Act, the government has created a law that allows us to practice medicine in Nigeria. It is government that did it. If they outlaw the Medical and Dental Practitioners Act today, practice of medicine becomes an offense. So the government has already provided a law, a regulatory framework for people to practice medicine. One. Two, the Code of Medical Ethics is there to guide those who have been inducted to practice medicine. And I did mention that Section 22, it's unfortunate that my other system crashed. So that's where all those documents are, and I've not retrieved them. I've not recovered them. So Section 22, the previous class, I used to quote it for them. Mr. Dennis is here. He can attest to that. So the next thing is, government is supposed to now do a law, because the only thing government, the major work of government is regulatory. So I need you to understand that. If a government puts a law in place to say this is how, if you want to practice e-health, these are the things you should do. Maybe Electronic Health Service Delivery Regulation Act, something like that becomes a law. Then it lists out how to register as an e-health practitioner. It lists out the penalties. If there are taxes you need to be paying to government, then the government will list it out. Then if there is a periodic report you should be submitting to know the number of people that we have been treated, to even help the government know how many Nigerians are utilizing e-health service for their healthcare. So what government should do here is regulatory, not for the government to build. If the government builds, it is an added advantage. But if the government has solid regulation in place, believe you me, private sector will drive it. But the challenge is, if the government builds, it is not usually effective because they lack, not that they lack the professional capacity. No, the government has abundance of resources, both human and material. But a lot of people see the government platform as opportunity to make money. So in doing that, the government sometimes does not have enough biting force to go after the people they put in place, because the people they appointed are their people. But if you are not their people and you try what their people did and go free, you will know that the government can bite. So two, what is the current state of e-health infrastructure in Nigeria, and what investments are being made to improve it? Very brilliant question. Now, firstly, you will talk about lights. Nigeria does not have lights. And the electricity, power is a major e-health infrastructure. So we are deficient in that area. And there is need to improve on it drastically. Anything you want to talk about e-health rests on power. If you do not have power supply, you will not make profit, so to speak, in e-health. Now, how much is diesel today? How much is fuel today? So, the cost of providing power for yourself as an individual is astronomical. The cost of providing power for yourself as an individual. Then talk more of utilizing it 24 hours for a healthcare service. So that if you are running e-health, your systems must be on 24/7, so to speak. Because as the services come, you render. If your system is not on 24/7, you should have the ability to turn your system on whenever the need arises without any inhibition. So if you want to turn your computer where you have stored patient's data and there is no light, you cannot turn it on. Because we've talked about the cost of providing generator or providing power for yourself through alternative source. The most common one is generator. The next alternative source of power is solar. And solar for now is for the high and mighty. So an average practitioner will not be able to afford solar to use to provide e-health. So if we are talking about what is the current state of e-health infrastructure in Nigeria, the current state of e-health infrastructure in Nigeria is that it is in deficit. It is in deficit. Then we talk about internet stability. It is not all the areas of the country that are covered network-wise. Now, those of us that are in city center, there are even times that the network goes off. I think 2, 3, 4 days, I wanted to do a POS transaction to transfer money. It took me more than 8 hours. You heard me right? More than 8 hours to do that transaction. Why? There was no internet. So the current infrastructure for e-health, 1, power, 2, internet coverage has not reached everywhere. So you see that we are in deficits when it comes to infrastructure. So the next question, what investments are being made to improve it? We hear that the government is working assiduously to improve the power supply. And there has been increase in tariffs, we hear. But until we see, I know that when they rolled out the bands, different bands, band A, band B, band C, D, and E, there is relative improvement in power supply. But it's also capital intensive. It should be relative improvement, it should be improvement in power supply and reduction in the cost of accessing it. That is, when we get that reduction in the cost of power, then we know that we have made progress. The third question, how can healthcare contracts in Nigeria be structured to prioritize patient-centered care and outcomes? Okay, let's dwell a little here. I wouldn't say that the question is wrong. The contracts are already structured, except if the person who is drafting the contract is not a trained lawyer. Any trained lawyer can draft solid contract. But like I said, when you say healthcare contracts, you are qualifying the contract. We already have elements of contracts. Contract itself is an area of law. In fact, it's a topic of its own. It's a course. 200 level law students, they train you first semester, second semester on the law of contracts. So we already have a structure for contracts. But when you talk about how can healthcare contracts in Nigeria be structured to prioritize patient-centered care? Now, it depends on the nature of the contract. For example, there are equipment supply contracts. When you are doing equipment supply contracts, the emphasis should now be on the quality of the equipment you are supplying. When you are doing a drug supply contract, the quality of the drug. So if you want to bring in patient-centered care elements into contract, we still talk about standardization and regulation, which is not, in quotes, which is primarily the responsibility of governments. How is it the responsibility of government? We have the Standards Organization of Nigeria. One of their responsibility is to ensure that every equipment, every goods coming into Nigeria meets up to the standard. You will find them in our ports authority. You will find them in our airports. You will find them in every entry point into Nigeria. So for healthcare, we have the Pharmaceutical Society of Nigeria talking about the Pharmaceutical Council of Nigeria talking about our drugs. We also have NAFDAC there talking about our drugs. So now these are government regulatory and standardization agencies. The hospital that is entering a contract is saying, supply us so and so drugs. If our regulatory agencies are alive to their responsibilities, what it means is that before that drugs get, well, as soon as the drug gets to our seaports, even before it leaves the country of production, before they load it and start sending it to Nigeria, our people at the other end should ensure that this thing is tested. If it is not done there, as they are getting to our port authority here, they should ensure that they are up to standard before allowing it into the country. So, to a reasonable extent, the hospital entering the contracts might not be in total control. Except where the CMD or whoever is in charge takes further steps that the products are supplied. The person now takes it to maybe a regulatory agency to say, we got this, we paid for these products that came in, help us check if they are up to quality. So we are talking quality assurance here. Now, it even boils down to consumables that are used in treating patients. I once handled a case whereby a woman was undergoing dialysis. What's it called now? The plaster that they use when they cannulate her, the plaster they use to arrest blood was not firm enough to hold the cotton wool and arrest the blood. So anytime they want to cannulate the woman, his son will go to a popular pharmaceutical shop we have here in Abuja, JIIPCC, to go and buy quality plaster. I mean plaster. You all know plaster. Her son will first of all go to JIIPCC to buy stronger plaster that is firmer, better than the one they have in the hospital. So he will go and buy the plaster and come and give them. Then they will use that one to treat the mom, to just, hold the area that was cannulated so that she does not lose, just arrest blood. So those fake plasters that found their way into the hospital, because we are talking about patient-centered care now, those fake plasters that found their way to the hospital, who supplied them? Is it that the management of the hospital or the storekeeper or the person in charge of the pharmacy is not aware of the quality of plaster that came in? So for us to achieve patient-centered care in terms of healthcare contracts, talking about contract of supply, not just that, contract of engagement, that requires that you engage qualified patients, or qualified healthcare professionals. So if you are even engaging your doctor, we are talking about patient care here now, patient-centered care. So when you talk patient-centered care, you are talking quality. So if the healthcare professional is not quality, you have already compromised. If the doctor is not a qualified doctor, there have been cases, I will drop a video on the platform. I think, did I drop it? Where small children were saying they're claiming to be nurses, that they are undergoing training as nurses. Teenagers of 14, not up to 14 years. So, they are not in any known established nursing school. They are undergoing nursing training. in a purported maternity hospital in one village. So how can that person be called a professional? If that person does that and grows up, and a hospital can hire him or her, of course, that hospital too is not qualified to be called a hospital. So if we are talking patient-centered care, we are talking about quality all through. Now, let me use this medium to educate the class on World Patient Safety Day. 17 September of every year, starting from 2019, has been designated by the World Health Organization as World Patient Safety Day. You can Google it. Now, World Patient Safety Day is a day that the WHO has set aside to draw global attention on issues around patient safety worldwide. Yesterday, I had the privilege of leading my team on a road walk to create awareness, because yesterday was Saturday and 17 September is Tuesday. Next week, 2 days from today. And all of us will be at different places of work. The court sits by 9 a.m. People will be in court. So we will not have the opportunity of having a walk. So currently I serve, of course, some of you know, I serve as the chairman of the Medical and Health Law Committee of MBA Gariki branch. So we embarked on a road walk to sensitize Nigerians on World Patient Safety Day. Now, why did I bring it? Because we are talking about patient-centered care. And the theme for this year's World Patient Safety Day is improving diagnosis for patient safety. Improving diagnosis for patient safety. That's the theme. The slogan is get it right, make it safe. What are you getting right? Get your diagnosis right. Make your diagnosis safe. I don't know if it is this set. No, not this your set. I told a story of a client I have, a case I handled. A lady was misdiagnosed of breast cancer, and one of her breasts was chopped off because the diagnosis said she had cancer. But when the hospital was not coming forth with her results to aid in post-surgery treatment, my organization wrote a letter, and it was that letter that we wrote that revealed that she did not have cancer, because we're asking, you did this test result more than 1 year now. Can you give us the test result? You did this test. Can you give us the test results? And it turned out that the lady did not have cancer. Now, that is a life-altering negative impact of misdiagnosis. We are talking patient-centered care. That's the last way. That's why I'm mentioning this. In fact, one of you here, Mr. Eneshi Sampson, is a lawyer. He's in my branch. He's on the call this afternoon. He was with us yesterday at the health work, and he's a member of my committee. So what I'm talking about, he was part of the planning. So you see, when we talk quality care, when we talk anytime you hear patient safety, anytime you hear patient-centered care, two words should come to your mind. One is quality care, two is professional care. If you remove professional care, because why I say quality care, it is possible that a professional can give a care that is not qualitative. So if you remove quality care, and there are a lot of indices that determine quality care. In fact, by the grace of God, on Tuesday, what's it called? The Federal Ministry of Health will be launching the Federal Ministry of Health will be launching a policy on Tuesday, this coming Tuesday. And what is that policy? Quality care policy. We worked on that document last year. We've been working on that document, and graciously, we completed it last year. But this year, it will be launched as a policy document to ensure that quality care, we are talking about, I'm emphasizing the question on centered care. So on Tuesday, we'll be launching the National Patient Safety and Care Quality Policy Implementation Strategy 2024 to 2028. Yours sincerely had the rare privilege of contributing to that document. On Tuesday, it will be launched. I will post the soft copy on this platform so that you'll be part of the early beneficiaries or to come in contact with that document. So are there live questions? If there are questions, you can ask. Does anybody have questions? We have exhausted the one you sent. Okay.
Yeah. Thank you, Mr. Ebenezer, for an hour and 50 minutes long presentation, feedback, as well as for answering the questions that were presented. So if we have any live questions from the mentees, you can ask the questions, or you can type your questions in the chat box. If there are any questions, you can turn on your mic and ask, or you can leave it in the chat box. Okay.
Do we have any?
It seems we have no question.
Okay.
We have
so
no
let me,
questions
if
yet.
you don't have question for me, I have question for you.
Okay.
Yes, it's a class now. If you don't have question for me, I have question for you. And the only way you can know that you know it is your ability to communicate it. So who can tell me, mention 2 or 3 challenges of telemedicine, you know, 3 challenges of e-health.
Why is it so hard to keep a Bible out?
Who can mention 3 challenges of e-health practice that you know? 3 challenges. Okay, that's one question. Yes.
The question goes for you, Mentees. So, apologies, Mr. Sampson.
Yes.
Can you turn off your mic? Apologies.
Okay, please, I want to answer the question. Can I go ahead?
Yes, you can go ahead. Meanwhile, Mr. Sampson, can you turn off your mic? It seems to be causing us a problem. Yeah, you can continue.
3 challenges of... Okay, my name is Ogenerona. 3 challenges of healthcare, of e-health, are digital literacy, lack of digital literacy, lack of regulations, or rather regulatory compliance, then intellectual laziness. Although I didn't really get this, but I jotted it down when Barrister Ebenezer was lecturing us. Then I think another one is the light and power issues we have in Nigeria. Thank you very much.
Thank you, Ogene. What is the most important
Welcome, sir.
Hello, sir.
advantage? Yes.
I want to add to that answer, sir.
Okay, please go ahead.
Yes, incorrect diagnosis could also be a challenge because clinical diagnosis ensures physical for you to be able to physically assess the patient. So telemedicine the camera might not perfectly depict especially if it has to do with maybe sores or some swellings like that. So I think incorrect diagnosis is a challenge, sir.
Inaccurate diagnosis, yes, you got it. Okay, next question. What is the major advantage of healthcare contracts?
Hello, sir.
Yes.
Sir, you said the most important factor of healthcare contracts is certainty.
Yes. Certainty of what?
Certainty of the contract, or of the terms, I need to say, of the terms of the
Certainty
contract.
of obligations
That's
of the parties. Not just
yes.
healthcare contracts. If you're entering any
Okay.
contract, please do not do oral contracts. If you are doing anything contract, document it. Now, certainty and enforceability is key. Certainty of obligation. Then it is not my word against your word. The document will speak for itself before the courts. So it is not, I said 22. No, it's not 22. It's 20. If it is 22, it will be on the document. If it is 20, it will be on the document. So certainty of obligations of parties is one. Two, you now have enforceability. Now, when I say certainty of obligation of parties, it gives you what you are supposed to do, the time frame you are supposed to do it, at what rate, at what point, everything. There is nothing like I forgot, because you signed the document, you have the documents. So thank you very much for your time. See you next week, Sunday, by the same time. We are gradually winding up, and very soon you will do your graduation.
Thank you, Mr. Ebenezer.
So, next week, Tuesday, this coming Tuesday is World Patient Safety Day. I have been busy, but I'm trying to put up an article. If I do, and it is published, I will drop it on the platform. I want to write an article. I already have the heading, but if I succeed in writing it and it is published, I will drop it on the platform for you to read. Then that is it.
Thank you. Thanks a lot. There are no further questions, so it is now picture time. I would encourage everyone to turn on your video for a quick screenshot. Thank you. I'd like to invite everyone to turn your video for a quick screenshot. Thanks a lot.
Okay.
I would like, once again, if it's possible for everyone, that would be very nice for us to take a screenshot. Thank you.
All right, so we'll be done in a minute. So please just kindly be a little patient. Thank you. All right, thank you, Ayodele, Victoria, for turning on your video. All right, so we're done.
Dennis, what are you doing about? You told me about 25 people registered for this program, for this course. I have not gotten 15 people in a single class. What is the problem?
So yes, sir, we in the last.
Have you removed some?
Not yet, sir, but I have removed them from participating in roles so that we can just know the specific number of people who are active, and those ones on the call are those who are assigned roles for the week. The rest, I don't assign them any roles at all.
No, it's not done that way. Not assigning them role, does it
Sorry. Please,
does
can
it
I?
mean they should not participate in the lecture?
Hello, sir.
All right, please go ahead. Victoria.
Yes, please. Last week I was not assigned a role, and you asked that those that were not assigned a role should message you, and I did that, but I didn't get any feedback from you.
Oh, all right.
Really?
Sorry about that. I don't think I saw your message.
Okay, that's Mr. Williams, right?
Yes, Mr. Williams. He asked us to message him if we didn't get any role assignments, and I did.
So does not assigning them any role, does it exclude them from attending lectures?
Not exactly, sir. So I was still planning to give room for those who may want to show a level of seriousness to still consider joining the program, to still consider joining. So I told them to message me, right? And those who did, I planned to ask them about participation and attendance. So in the light of that, I think only a person or two reached out. I did not see Victoria's message, so I guess that's the reason why I did not respond. So in the coming week, if no response from there yet, then they'll be removed from the group.
It's okay.
Yes, sir. Thank you very much, sir.
All the best, everyone. Enjoy your evening. Thank you and goodbye.
Thank you. Thank you. Everyone, don't forget to share what you have learned on your different social media platforms and tag your mentors. As we come to the end of our session, I'd like to thank our mentor, Mr. Ebenezer, for his invaluable insights and our mentees for their thoughtful presentation. This has been incredibly an enriching session. Thank you and have a great day. We look forward to seeing you in the next session. So good evening, everyone.